Okay, so chapter one, I am not going to dive into a lot of detail about this material because it's pretty straightforward. But what I am going to do is take the lecture that I want you to use as your guide moving through this first chapter as you read to kind of take notes. So it's a little bit more involved for the first couple of chapters just to help you get used to taking notes from the textbook. But what I am going to do is go through and highlight a few different avenues of what's being discussed in this first chapter and put it a little bit more into application or practice here for you guys. So you can see some of the learning objectives that are identified here, and you can move through this PowerPoint at your own pace as you move through the chapter one readings as well. So the first thing is, who are dietetic professionals? I think that there continues to still be a little bit of confusion around this and the terms dietitian and nutritionist and what is a registered versus a certified and some of those different terminologies. However, the most recognized continues to be the registered dietitian, nutritionist, RD, or RDN. So you can use either of those two. I am not a huge fan of this. I think it makes it a little bit more confusing for people, even as they're starting to understand what a registered dietitian is and what we do. However, you do have those two options. It requires a 4-year undergraduate degree along with a supervised, as you guys all know, matched internship anywhere from 6 to 12 months, usually around 9. It requires that you complete an exam and that you maintain your credentials through the Commission on Dietetic Registration each year, which is about a $70 fee annually right now. And then you have to obtain continuing education units, or CEUs, in a 5-year cycle. So every 5 years, you have to obtain 75 hours, with 1 hour counting towards one CEU of continuing education. So seminars, webinars, readings, you can go back to school and take a class. All of those would count towards the 75 hours that you need, and different things count towards a different amount of time, and certain things you can only get a certain number of those type of hours, and they have limits on that, but that is the standard across the board. We also have the nutrition and dietetic technician registered, the DTR or the NDTR. This requires a 2-year specific degree. It does also involve an internship or a supervised experience. There is also an examination. You must maintain your credential with CDR, and it also requires CEUs. So those are the two that occur most often and are also closely connected to the Academy of Nutrition and Dietetics, which is the largest organization supporting registered dietitians. So you do not have to be a member of the Academy of Nutrition and Dietetics in order to be a dietitian. It is completely optional. You just need to maintain your CDR credentialing every year. If you let that lapse, if you let your CEUs lapse and your CDR registration lapse, then you have to retake the exam again. I wouldn't pass that puppy right now without a lot of studying. So it allows you, and the CEU process allows you to get specialized into different areas through how you maintain your practice or your job, and it keeps it all relevant to what you're doing for the most part. You want to make sure that you have a strong ability to understand the difference between a nutritionist and a dietitian. We used to talk a lot about the differences between those terms, and I think that's part of the reason why that N was pulled into the credentialing, was to kind of take back ownership of the word nutritionist, but RDN gets a little redundant. So I don't think that it really matters is the bottom line when you're just talking semantics. What matters is, what is the knowledge base that the person that you're going to be paying money to or taking advice from, what is the knowledge base that they're coming to the table with, and where is that information coming from? And that is one thing about registered dietitians, is there is a consistency and an elevated standard that occurs here, even compared to some of the other credentialing that is out there for people who are not registered dietitians. So one of those options is the CNS, the Certified Nutrition Specialist. There is a body of what appears to be mostly PhDs and MDs with a focus on nutrition. The majority of them do not get the RD credential, and in fact are kind of trying to approach nutrition from what would appear to be an alternative route, like looking at it through a lens of holistic and alternative and integrative and functional, like those terms that you often hear. So a CNS, I actually looked into this because I didn't want to have to go back and get my master's degree to become a dietitian. So it was really funny, but it ended up being the same amount of work with the least amount of job opportunities for the degree. So it requires a 4-year degree. You have to have a master's degree or higher. There is an examination that needs to be taken through the organization, through the Certified Nutrition Specialists organization. They have their own organizations and their own credentialing system. It's all run through that. And again, I find that a majority of those professionals probably have an additional background. It is a little bit more research. It is a little bit more clinical as it relates to coming from a viewpoint of a physician or a researcher, but not necessarily a dietitian or even a nutritionist. It's like gaining knowledge to enhance what it is that you have as an understanding, but it still identifies through evidence-based practices. And they have some connections to some additional organizations as well. So they have to have essentially 1,000 hours of supervised practice, which is their version of an internship. The difference is you can be seeing people. So if you were a health professional and you were already working with people in a private practice capacity, then you would be able to count these hours. I am so sorry if you can hear my dog just heavy breathing over in the corner. It's driving me insane right now, but she won't leave the room. It is all done through the American College of Nutrition, which is the organization I was trying to think about. And there is a CEU and a time frame that is required in order to maintain this credential, which is a pretty universal way of doing credentialing in general. The additional way to go is a CCN, which is a Certified Clinical Nutritionist. This is done through the Clinical Nutrition Certification Board. 4-year degree along with experience, a 900-hour internship, master's degree or higher. It does have a nutrition related field. And in this particular CNS degree, those MS classes and the additional advanced degree classes you have to take are also mostly health and nutrition focused. There is their own examination. And then this is the organization that really tries to put an emphasis on, now the other company, the other credential, the Certified Nutrition Specialist, has an aspect of this too. There's a little bit of a misconception that as dietitians, we all just practice based on what government standards are set, meaning I go into my office each day with what used to be the pyramid and what now currently is the MyPlate, and we just teach this very generalized, non-specific nutrition philosophy. So a lot of what happens with these two specific nutrition credentials is a lot of use of words like individualized care, evidence-based care, medicine-based care is things that you would hear from here, but everyone loves those keywords like alternative medicine or integrative medicine or holistic, that kind of thing. So this credential in particular takes that a little bit further. And if you read through what I had pulled off the website, which was a couple of years ago now, so I'm not sure if it's still there, but at the time it was on the Certified Clinical Nutrition information page, where it says the CCN's approach to diet structure is developed according to what is best for the individual, not what is standard recommendation for the general public at large. or for all people experiencing that particular health concern. You mean we all operate differently? Rather than strictly advocating a pyramid or a food group style diet, the CCN will determine the healthiest and most effective program for the individual according to the latest nutrition research and the unique biochemical makeup of the individual. It's exactly what registered dietitians do. But again, that misconception, the lack of understanding within the medical field, and a medical field that sometimes has a tendency to want to do things their own way and doesn't want to have to work with a huge organization such as the CDR, the Academy of Nutrition and Dietetics, in order to have that kind of collaboration. So these are just a little bit less of a monitored and structured form of being in the field of nutrition. And as you're going to see, and as you may already be knowing as you move through your degree, it can become a little bit concerning, especially with people that are able to promote having a credential, and yet that credential also includes not putting out the best types of information. But we as RDs also need to make sure that people understand why we are the best at what we do. So there are additionally some food service related credentials. The certified dietary managers actually have a lot of dietitians that are asked to get this, even in non-food service related positions. The certified food service director, you'll see they all have their own organizations, and then the school food service nutrition specialist. But these are all great advanced recognized credentials that a person could work towards. So food service management positions, here is just a list of a few of the options that are out there. Traditionally speaking, careers in dietetics really presented in a lot of the traditional senses. So even when I was going to graduate school just a little more than a decade ago, I had an idea for what I wanted to do, and it was that concept of like worksite wellness stuff that was going on a little while ago. We don't quite see as much of anymore, either that or it's just already established and ingrained and not a hot topic. But the idea behind what my options were and what I felt like I could do, it always felt a little unappealing. I had really no desire to go into food service. I'd never worked in a kitchen. I'd never worked in a restaurant. I love to cook and I love to do that, but I just don't have that industry is just overwhelming to me. So food service just was never my thing, although I really liked my internship rotation. Clinical had very little appeal. I fainted on my first day of the internship onto a grandpa in a patient's room. Yes. I stayed the rest of the day. That was how bad my anxiety was. That has never happened to me before. And I made it through, and I ended up actually working at the hospital for a little while as a diet tech and then an on-call RD just to get over my hatred for the hospital. And now I'm okay. Like that can be an okay experience for me, but not what I want to do. So food service, traditional clinical, kind of that inpatient, outpatient hospital setting. Community nutrition, working in public health or in some arena around kind of community nutrition, public health. Those have been a lot of the avenues that we've always traditionally been seen as being very successful and having a lot of really good opportunity to kind of dig our hands in. And yet, we've missed a lot of additional opportunities that continue to be out there. So those outside of these traditional things, being a supervisor in food service management is not in and of itself a new career path, but having a dietitian as an executive chef, that would be interesting and a new career path. Looking at sustainability or environmental practices for a particular company and bringing in a registered dietitian to help evaluate that as it relates to what you're doing in your food service arena, that would be a new position. But any kind of food service or clinical or community or public health, those are all pretty traditional avenues for us. But again, we are able to really branch out and see what's happening. Not to mention even being like the back of house manager, collaboration on menus and menu development, all of those different types of things are new positions that are available to us. We do have a number of different types of food service you're going to want to take a look at. Commercial food service, on-site food service. So commercial is where You have to track to customers. You don't have an on-demand customer. So you're going to need to do certain things and have certain appeals that bring in business for you. So this can be anywhere from fast food to fine dining establishments. This can also include convenience stores. Do you have a certain pull that's going to bring people in for a particular product, and then maybe they'll buy other things in additional? There's a lot more of an opportunity to work as dietitians within supermarkets and large supermarket chains. A lot of them are having dietitians in-house to answer questions, or kind of back of house on the business end, doing collaboration, doing some consulting, evaluating products that are being purchased, or using the dietitian as a form of marketing for how that store is operating as it relates to making food decisions, sustainability, local, whatever the draw might be. Obviously, we continue to have food court options as being a commercial food service component. And now we have this mobile food vendor component. So whether you're coming at it with an interest in food service, that makes the food service a little more specific, way more niche, which is like very targeted towards a specific audience or a specific product being done right. But you get to kind of play with the nutritional component and the food service component all in one tiny little business. So a lot of opportunity and kind of that small business growth that presents there. On-site food service is where you have people who are a captive audience. They don't have a lot of choices where to eat. This could also involve some subsidization. And in some instances, it can be very profitable. So this would include if you had dining within a business or an organization, healthcare facilities such as hospitals, daycares that are feeding, schools, prisons, military, senior centers, anywhere where they may still have some choice, but everything is being brought in. They're not going to be going out and looking at other options, and you're not competing with anyone necessarily. Again, not a lot of those options have changed. Dietitians have worked in food service in the clinical arena, in the long-term care arena, and also in the school food service arena. We've always been involved in those areas. What's happening is we're really starting to branch out into other areas where food service is being offered. Self-operated food service is independent with a one-of-a-kind operation. The manager and all of the employees work for the business and the institution that operates it. There are some different advantages and disadvantages to that particular type of food service. Again, I'm not going to go into all the details here, so make sure that you're studying some of this. Contract management is where the on-site food service is operated by an outside management company. So the business or institution hires that company with some particular guidelines and stipulations and parameters and budgeting and all of that kind of stuff established. And then that company comes in and provides the food service for you. Because you're buying the full service and because you're buying in bulk, you're not having to hire a lot of the staff required for the back-end development and purchasing and ordering and storing and stocking and all of that of the food. So while you may not be making a huge profit off of it, you might be able to do it for a very reasonable cost. So you may outsource it in that way. So I've gone through a few of them, but some disadvantages and some advantages. So I want you to also think about what types of trends you've been seeing in food service and nutrition within maybe the last 5 years or so. So I want you to think about ways that we have changed how we engage and interact with our food choices. So two of the big ones that come to mind, aside from the mobile food vendors that I've already mentioned, would be kind of that food delivery component. So we still want to connect to our food. We still want good flavors. We still want that freshness, but we need it to be easy and time saving, and we want it to be guaranteed to be awesome. So companies such as Blue Apron or Sunbasket or HelloFresh, or I don't know what other ones are out there and operating. I use Blue Apron myself, so that one's easy for me and I love it. I have one in my fridge right now, 3 nights, 2 people, and my husband and I enjoy them as our kind of little treats throughout the week. Plus, he and I can kind of cook it together. It's got enough instructions where I don't have to tell him what to do. So it's actually really great for us. As my kids get older, you know, I may just get the larger serving size and share it with them. The other thing that's happening is this the favorite foods you love being delivered straight to your door. So Uber Eats, Postmates, Grubhub, I don't know, depending on where you live, there's all kinds of different things out there. And I live in Phoenix, so a lot of this stuff comes to us first, and I travel a lot for speaking and work and those types of things, and I would get to a city, and I remember when it first started happening, I'm like, this is awesome, when I'm staying in a place where I don't have a lot of access to anybody. And keep in mind, Uber didn't hit everywhere for a long time, so I was still having to take cabs places, and that's expensive, and it's hard to do, and they don't show up on time. And so for people that travel, Uber and Postmates and those types of things have really made our lives so much easier. But the downside is you have to recognize the cost of some of these things. I also am not a huge fan of the Postmates. The couple of times I've done it, like by the time the food finally gets here, it's just not as warm and as enjoyable. I could have probably just gone and gotten it myself and it would have been fine. Plus it ends up being a pretty expensive meal once you tack on some of those fees. The final thing that isn't on here is also just grocery delivery and pickup services. And that's not even just at grocery stores, but places like Target and Walmart and other places are trying to make it so that it's more convenient for people, because we don't have even enough time now to sit at the restaurant, right? So just kind of recognizing some of those different trends and how they're working out well and how they may not be working out well and continue to kind of ebb and flow and change. Additional trends in food service are always changing. So right now people are looking for things that are fresh. We're looking for environmentally or sustainably aware solutions. We're looking at things that are locally grown foods. We are trying to incorporate more whole grain options. There's different legislation that is out there to eliminate essentially trans fats from the food we eat, to have a mindfulness around sodium, high fructose corn syrup. It talks about strategies to deal with obesity, but we are not finding that strongly regulating and restricting people's food intakes is necessarily fixing that, as we look at the growing fad diet industry. You would think if these fad diets all worked, then we wouldn't continue to be talking about some obesity epidemic. So the idea behind how we view what's going on, in particular with trends in food service, is very important, especially as dietitians, in that trends that happen on an individual basis eventually make their way into food service, as we've seen with different components of the first low-fat phase, and then we went into the low-carb phase, and then we moved into the gluten-free phase. And I'm just starting in the 80s. I'm not even trying to go that far back. So we were not only carb restrictive, but now we're super carb restrictive because now we're gluten fearful. And then we went into the paleo. So we're really kind of going back to that whole foods concept. And then we had Whole30. So if you think about all of that, restaurants have to eventually start responding to that demand. And you even see in some of those different companies, like I was talking about, like Brew Apron and some of those, they'll even promote that they can support different types of diets like keto, like Whole30, even paleo, gluten-free, dairy-free, vegetarian, vegan. So they're becoming very accommodating, which is hard to do in food service. You can only give so many options before it really does kind of put a hindrance on your kitchen and your purchasing and all of that kind of stuff. But be really careful how much you're trying to get in on a food trend, because it is oftentimes just that, a trend. We saw at one point all of the yogurt shops popped up. We were all starting to put our own toppings on, and then that kind of trickled out, and a bunch of them kind of fell by the wayside, and a few stick around. But same thing with like the juicing and the phase of cold press and detox juices and all of that. A bunch of them popped up and then they kind of trickle out. Now, we still have a lot of them, don't get me wrong. So you just want to be really careful how much you buy into some of those food trends, how much it's helpful for you, how much it supports your current clientele, and how factual, actual, true it is. How much are you promoting this messaging from a good place? Fusion cuisines is another big trend where you take different opposing cultures or flavors and you try to find ways for them to meet. Continued trends in food service that I've kind of touched on a little bit, and you can touch on more when you take a look at the textbook. These are different management positions offered in clinical dietetics. Again, a lot of these different clinical positions have been there for a long time. Dietitians in the hospital realm is not new. One of the things that is new and emerging within that arena is just the influence and the impact that dietitians are starting to have. For a long time, dietitians could not even write orders. They were essentially suggestions for the physician. So we're really trying to make our way, not be crazy, but we're really trying to build and make our way to having dietitians have a great voice, because it's coming with a great understanding and a knowledge base. And so if there's a conflict or an issue, it should be discussed just like you would in any kind of multidisciplinary collaboration. And dietitians are really starting to push for that and have been pushing for that for a long time in clinical arenas, and I think are really making a difference there. So this is just a summary of how the positions would move through, from that clinical nutrition manager to the chief clinical dietitian to the patient services manager to just the RD who comes in, does their work, and then head home. And then we have that clinical diet tech as well. Again, moving into that public health nutritionist, a dietitian or manager in a community nutrition, an advanced degree with public health. And they have managerial roles overseeing different community nutrition components, agencies or programs. Community dietitian, they work with their community, give direct care to clients. Management skills are often required as a part of the job. Again, additional public health nutrition type positions that are available. Most of these are positions that have been around for a very long time, related to how dietitians operate within and support the public health sector, and they very much do so. Other things that have started to present themselves is management and supervisory positions in healthcare outside of the food service or clinical nutrition services departments. So you'll find that dietitians might be managing multiple different departments. They may carry administrative positions outside of the nutrition field within the healthcare arena. There's also a lot of different opportunities for contract management positions with companies. I have one myself. I'm the nutrition director of an eating disorder treatment center in Florida that I consult with and I work with, along with my position at Arizona State University. You can work within the industry. You can work for pharmaceuticals. You can work for different supplement products. You could even be somebody that works for the Beef Council or the Egg Council or the Spirits Council. You could help promote the sale of alcohol. There's a lot of different positions that dietitians are being noted for because of our knowledge base, our ability to connect and explain information, and a lot of the training that we have in management as a part of the dietetics degrees practices. There's positions for sales and marketing. Again, I mentioned the supermarket positions, continued opportunities in education. I had never considered that teaching was going to be a part of my career path, and I absolutely love it. Also working within nutrition policy, there is so much work to be done within nutrition policy as it relates to passing actual legislature that's helpful to people, as it relates to having an influence on having dietetic practices covered and offered by insurance companies, which they aren't currently. Imagine if everyone got 2 registered dietitian visits a year. How awesome that would be, right? People would really be connecting to what they're eating, how they're eating, and also what their relationship to how they're eating looks like. There's also additional volunteerism opportunities that are out there with the Peace Corps and ways to go abroad and offer support as well. So lots of entrepreneurship happening in the field of dietetics. We have growing private practices. We have growing group practices all over the country. I have colleagues all over the country that own a private practice business with anywhere from 1 additional RD up to 9 additional RDs, multiple different locations. Just like a doctor's office, a physical therapist's office, other health practitioners out there doing amazing work. Again, there are volunteer positions available in civic and professional organizations. It is also important that you always consider that a small part of your career is giving back, whether that's giving back to your profession through professional organizations and giving your time that way, or through maybe additionally having some lower priced services available for some people within your practice. Not everyone, but a small percentage. So you can move through some of the conclusions. I think the conclusions at the end of the slides are great because it's a good way for you to kind of reflect and review. I don't know why I keep doing this. You guys aren't all crazy, and nor am I. Sorry. It's a good way for you to reflect and review, in particular before a quiz or exam. I would suggest kind of running through these conclusion statements, which are the last few slides, and just seeing how you're able to answer what some of the thoughts that come up for you. All right. See you next time, guys. Thanks for joining me.